I'll be good.
Okay, so we're now live. We'll just wait a few minutes before we start kicking in, but just to give Eunice and Elaine warning that we are live. So yes.
Loving your purple tops, thank you. Yes. And yeah, you're both outside. I'm quite envious of that. It looks lovely.
Yeah, such a lovely day.
Best place to be instead of stuck in an office, but yes, but never mind.
Yes, that's the downside.
Yes.
I get to look out my window, and occasionally mid-meeting I'll just take off. There'll be a red kite that goes past, and I get mesmerised, and I just sit watching.
They're so beautiful, aren't they?
They are.
We get them going overhead here too. That little whining noise that they make, whistling.
Yes, it is unique.
Yes, we've got quite a few in Hertfordshire as well, actually. So it's lovely when we see them go past in the sky. Lovely birds.
Yes. Although we were at the pub the other weekend and in the beer garden, and somebody had left their table, and one just came down, swooped in, and took a bit of leftover off the table and took off again.
Being as brave as the seagulls.
Yes, even more so.
Well, actually, the other day I saw a seagull chasing a red kite. I thought that's a very brave
they
seagull.
do that.
Wow.
No, they do that. A lot of birds don't like the kites, so they'll just come and harass them.
They're very big. They're magnificent when you see them close up.
Huge, aren't they?
The wingspan.
I've seen crows or something sort of dive bombing them. I think they're crows anyway, something big and black.
Yes.
Yes. No, because they only really introduced them, I think, again, in the last few decades into kind of the children's and that area. But it's so successful how it's done.
Yeah,
there's loads around. Yeah, and they're just beautiful to see. So
yes.
Right then, shall we get started?
That sounds like a good idea.
A few minutes have gone. Right. So it's just to welcome everyone really to the first Facebook live session of the week of the first Wear Purple hashtag Wear Purple for JIA Wellbeing Week. It's the first time that we've had a week-long activities, and actually on Friday is kind of the traditional sort of Wear Purple day. But if you're like us, you just wear purple most of the time anyway. So yes, so thank you both and everyone for all looking so purple, and Nadine with your purple hair. We haven't gone to that extent, but even so, it's a good effort. We had our first wellbeing class today, which was the art class, which was run by Nancy, who was diagnosed with JIA last year, and she is such an amazing artist. And the class went really well, and just in awe of her and people that can do art. It was really, really good. So if you did come, please send us your photos of your pictures, and we'll kind of get them up and we'll showcase them because they were absolutely brilliant. So kind of as an introduction, I am Debbie Wilson, the Young Persons Project Coordinator at NRAS, and we're here joined by my colleague Nadine, Eunice and Elaine, and I will let them introduce themselves to you. So I'll let Nadine go first.
So good evening, my name's Nadine Garland. As you can probably hear, I am Australian. I've been with NRAS for a bit over a year. I arrived in the job about 10 days before lockdown, and I am the Information and Support Services Manager, and have lived with RA for over 30 years myself. I was 19, so some people said I probably had JIA, but it didn't get picked up until much later. And yes, I'm also a nurse back home and worked as a youth coordinator for Arthritis New South Wales. So I just love what Debbie's doing with the youth and young people working with JIA, and I've had the pleasure of knowing quite a few people and seeing them grow up. I used to run camps for kids with juvenile arthritis, and they're all now having children themselves and still sort of growing and just being amazing young people. So this is a real interest for me.
Eunice, I'll let you introduce yourself.
Thank you. Hello, hi, I'm Eunice. So I'm currently a nurse specialist at the Evelina Children's Hospital in London. So I've been there for about 6 years and previously worked in the service in Oxford. So I've been a nurse specialist in paediatric for almost, I think it's 10 years now, might have been 11.
Wow.
But I love it as a speciality. I love getting to know the families and really being able to build relationships with them. I've got some personal experience of arthritis. I have 2 sisters with juvenile arthritis, so I have a little bit of an understanding from a family perspective as well.
Sure. Thank you so much. And lastly, Elaine.
Hi everybody, my name's Elaine. I'm a nurse specialist based in Oxford. So Eunice and I worked together when she first joined the team, which was great for how many years, Eunice, help me? 4, was it?
How many years ago? Yeah, 4 years we worked together, yeah.
So I've been a nurse specialist now for 12.5 years, I think. Working all the time in Oxford, which I've very much enjoyed. As Eunice said, building relationships with families, some of whom I've known that entire time, which is great. Watch them grow up. Some of them leave and go on to university, and some into employment. So, yeah, great job, which I very much enjoyed.
Excellent. Well, thank you so much for that. And it's my heartfelt thanks for joining me this evening, because I know obviously how busy you have been, especially over the last year. So thank you so much. We really appreciate the time that you're giving up this evening. I really do want to raise more awareness of JAA and help people understand the disease a lot more. I have JAA and my daughter has JAA, so kind of coming from a patient and a parent as well, I know the impact that this can have, and having support from the nurses. It's just, you are our first point of call. If we have a problem, we call you up, and it's just so nice to have that support at the end of the phone call. So thank you again from probably all your families as well. We really appreciate that. The questions we're going to be asking are mainly kind of sort of from a parent's point of view, because we know that when your child does get diagnosed with JAA, it can be quite overwhelming, and I thought it would just be useful to give more parents information about JAA and knowing they're not alone going through this, and how they can help their children thrive with JAA. I think before we really sort of go into the questions, we probably should just cover the COVID vaccinations, because that will be a hot topic. And just to say, we don't know yet whether children of 12 to 15-year-olds will be vaccinated. I did listen to Boris this evening, about an hour ago, and there was no information at all. It has been approved for those 12 to 15-year-olds. However, it has to go through, and I've got it written down here, it's the Joint Committee on Vaccination and Immunisations, the JCVI. They are the ones that advise the government on whether these children should be vaccinated. So we wait to hear any announcements, and as soon as we know, we will let you know. So yeah, sorry, nothing, we can't announce anything this afternoon
until we know. That's it. And the JVCI
Yes.
have advised that it's only those at very high risk of exposure and serious outcomes should be offered the vaccine, and that's their advice at the moment. There is ongoing research, but as with all research, you don't want to make a statement before the research is ended, because you can get false outcomes is the word I'm trying to find. So yes, but as Deb said, as soon as we know something, we'll get it out there, and we don't want to sort of make people concerned before we know what's actually going to happen. And even when there is a decision made, there may not be an announcement on how that is going to happen. So it may take a while, but just be patient. It's not that it's not being researched or discussed. It's just there are no outcomes yet.
Yeah. So yes. So anyway, on to our sort of Q&A session. I think Eunice, you've seen our sort of questions beforehand. Elaine, you haven't, but don't worry, they're not very taxing. Firstly, I'll ask Eunice, it is hard to describe to people what JAA is. From a sort of medical point of view and from a nurse's point of view, how do you explain what JAA is?
Yeah, so I generally break it down into the JIA. So to sort of explain the umbrella term, so J standing for juvenile, meaning someone's less than 16. Idiopathic, meaning there's no known exact cause. So we know you'll have a genetic risk factor for it, but then something has to trigger that risk factor, but it's nothing you've sort of done or specific that's caused it. And then the arthritis is a swollen, inflamed joint. And I use, so if you think of sort of oil in a, so if you think of fluid in the joints as the oil that lubricates it. So when you've got arthritis, you overproduce that oil, and the lining of the joint becomes inflamed and thickened, and then it clogs the joint up, and so that's when it's swollen and stiff and difficult to move because of that extra fluid in the joint. And then also talk about it being a problem with the immune system. So the immune system that's there to fight infections can get confused at times as to what's infection and what not, and mistakenly thinks there's maybe an infection on your knee or somewhere, and it sends lots of cells there to fight it, which is what causes this extra fluid in the joints.
Okay, that's really well done. Is there anything else you'd like to add on that, Elaine?
No, I think that's that's a pretty adequate description, if not a very good one.
Yes,
I
excellent.
learned from you, Elaine. It's probably the very word you taught me.
No, I think somebody else taught us those.
Now,
Cool.
both of you have been working in the field for a long time, and so you would probably see this every day. There's still that lack of awareness that children get arthritis. And so what should parents look out for? What are some of the signs that your child may have juvenile idiopathic arthritis or any form of arthritis in children? Who wants to start that one?
Shall I start that one?
Yeah.
Okay. So symptoms vary from sort of none really to quite a number. So there's no one thing that you could say to parents to look out for. And I think, often parents feel guilty because they haven't noticed, and I don't think they should, because their kid might be running around apparently fine, but may have a bit of a swollen ankle or a knee. But children are very good at accommodating. So they may not have noticed, the child may not be in pain, they may not be complaining. So actually it's really hard, especially with the younger ones. Sometimes it's very obvious, there'll be a big swollen knee, and that's a very obvious sign, but often not much in the way of discomfort. So that's makes it difficult for parents, I think, to know. With an oligo JIA, so that's a child who's got just one or two joints. With a child who's got more joints, they may have slowed up a bit. They may be struggling a bit with different things. Stairs, sitting cross-legged, particularly in the morning, a bit of early morning stiffness in joints. So just coming down the stairs in the morning, that might be something that they notice. But yeah, as I say, a lot of variation in presentation.
So also, but I really like the point you made there, Elaine, about the fact that there aren't always a lot of signs or symptoms, and it's not that they've been negligent or that they've missed something. It is really, really hard to spot sometimes.
Yes.
Yes. So if kind of, a parent does notice that their child is, as you say, coming down the stairs differently, slightly slower, quite stiff joints in the morning, what should they do? Where's their first point of call?
Well, usually the GP, who may or may not have seen JIA. So that's also the difficulty. If they have and they know about it, then great. But they should probably refer on to a paediatric rheumatologist who would make that diagnosis.
Okay. Does that differ around the country, do you think?
I think sometimes it takes a while to get a diagnosis. Parents are often sent away and told it's growing pains if they've got some discomfort, or it's nothing to worry about. And so yeah, it can take some time. And I think as you say, awareness of JIA is not always, even among health professionals, is not well known about. So it
How
can be
about
difficult.
GPs? You were saying take them to the GP. Is it often that they miss it too?
Sorry, I missed that.
Is it do GPs sometimes miss a diagnosis of JIA, or miss that there could be something going on?
They might, but if they're, if they have concerns that they're not sure, then often they will send to a paediatrician, if not a rheumatologist, and then they will find their way into the right place.
Oh, that's good. So one of the biggest causes of stress after the diagnosis, which is a huge cause of stress for all families, is the thought of giving their child these medications. So can you explain to us how medications work and why it's important to maintain the continuity with the medication?
Which answer?
Start?
Yeah, there's obviously lots of medications. And I guess we use anti-inflammatory medications like ibuprofen. So that's something that you're commonly started off on at the beginning. So your GP might start that, or a paediatrician. So that's something that lots of people start, and often we use it in higher doses than's on the bottle, which is sometimes makes people a little bit worried at the beginning. But we know from experience that that's absolutely fine if prescribed by the doctor to do that. And then thinking really, so we've talked about arthritis being a problem with the immune system, is we need medications that work on the immune system. And obviously that gets parents worried about, well, will that mean they're going to get lots more infections? And so I normally explain it in that the arthritis is the immune system that's overactive. And so things like methotrexate, which is commonly used, a weekly medication, just calms the immune system down where it's overactive, but still allows you to fight infections. So that's how I would sort of explain methotrexate to a family. And then the other medications that we use, maybe if methotrexate wasn't effective, work very similarly, but maybe they target very specific parts of the immune system that we know are really important in inflammation, whereas some of them like methotrexate work quite generally on the immune system.
That's really useful, because I must admit, I think I was talking to Nick Wilkinson, who, Eunice, you work alongside, and he was saying it's kind of just the medication's gentle nudges on the immune system. It doesn't completely suppress it, it's just giving the gentle nudges on it all. And actually, as a parent, that was really a good way of kind of having it in your head to kind of explain it, and you're not feeling too daunted by giving it to your children. So it's and I think there has been research that sort of shows that even children are kind of on these medications don't get more infections than say others that aren't on those medications. So so please don't feel daunted by it. It is a very useful and an amazing treatment out there. So but yeah, I suppose, but the only other thing with the medications is the side effects. Have you got any sort of good tips that could kind of help parents with some of the side effects from their children? I think I'm not sure whether Eunice is there, but Elaine, I'll pass that to you.
Yeah, okay. So with methotrexate, which is, as Eunice said, the sort of usual medication we choose to start treating JIA, one of the side effects is nausea, which is pretty unfortunate and can be quite problematic for some children. So we do advise taking some folic acid, and then sometimes we would prescribe an anti-sickness medication alongside that's taken before and after the dose each week. That can be really helpful, but for some children those side effects persist, and then we would just think about moving to a different medication. So we would move not only if the medication was not efficacious, but if the side effects were too overwhelming and unpleasant, because it's not really on to leave a child feeling grim every week following their medication. So we would quickly move away from that and try something else.
Okay, so if there is a parent out there whose child is really suffering with the side effects, to kind of get in touch with their rheumatology team and see what other medications there are, is that the point?
Absolutely.
Brilliant. Okay.
And it's not every
And-
patient who's affected, so I think,
No.
you know, so
No, that's it.
it's maybe 3 in 10, then hopefully 7 in 10 don't have those side effects.
Mm.
And one of
Sure.
the things I found when I was on methotrexate was that I'd have a nice supper and have it afterwards when I was taking the oral rather than the injections, and then go to bed. Because if I was feeling nauseous and asleep, it didn't really matter. It didn't impact on my life a huge amount when I did it that way. So, yeah, and talking to other parents about what they've done, because they're always really good. If you meet other parents when you have appointments and things like that, I think it's really a useful thing. And yeah, just knowing that you want to make this as easy as possible for your children. You don't want to traumatize them again with feeling anxious about taking medications, because that's got serious side effects. So I think it's really good too that the rheumatologists are listening to parents and the kids when they say that these symptoms are just not acceptable. We need to look at something else. So they're a lot luckier than a lot of adults that have to stay and meet the markers and everything else.
Yes, that is not a plus side, but it is good for children with JAA that you can sort of move on to medication more so than even people with, even myself, as even with adults with JAA. So yes, there is other medication.
That's it. We've just had Joanne say my son couldn't tolerate methotrexate and is now on adalimumab. So there are next steps. So it really is the first stage, and I think it's really, really encouraging, much more encouraging than 20 years ago when I was running camps and I had 55 kids that were on methotrexate. And so it's a lot better these days. But with the medications, one of the other things is blood monitoring. Can you explain why it's important that they do have the regular blood monitoring, and any of the good distraction techniques, or how to calm a child before they have to have their blood tests?
So methotrexate particularly, you do need to do some blood monitoring on, and some of the others we use. So we just need to keep an eye on your cell count and particularly your liver function, because occasionally that can be tickled by methotrexate. It's not too onerous, the blood monitoring for children. We do a lot less than for adults, and we do that safely. We don't find problems with the fact that we do less than adults. I guess from my point of view, probably just trying to set it up at the beginning as well as possible, and making those experiences as positive as possible, because it's very easy once you've had one maybe difficult experience, it's quite hard for the child to then move past that. So right from the beginning, taking that time to maybe make sure local anaesthetic creams are working, just having that input at the beginning to try and make those experiences as easy as possible just helps then for the future. But that's sometimes hard if people do have, say, a hospital visit at the beginning, or so maybe they've gone through A&E or something, or they've seen lots of different people maybe before they reach paediatric rheumatology. That can be tricky because they might have had difficult experiences, or they've had someone who's maybe not as experienced as taking blood in children. But those are things that can be helpful. So if you've got someone who's very experienced in taking bloods in children, and then you do the right things to try and make that experience as easy as possible.
No, that's really useful, because I must admit, when my daughter was diagnosed, I didn't quite realise, even though I was on adalimumab as well, that actually the blood monitoring, it kind of completely went past me, thinking actually she'll have to have it all done as well. And yes, it really does help when you have people that sort of know what they're doing with young children, to take the bloods and that. And I kind of find sometimes on the early stages, not all parents do it, but kind of just a little treat once in a while, afterwards, just to let them know that actually, yeah, you're brave, you're doing well to kind of deal with this disease, and also everything else that goes along with it. It's great that JAA can be treated, but it's just kind of the impact that kind of the medications, the blood time, the blood monitoring, the hospital visits, they do take its toll on kind of children and the parents as well. So I know one of these questions isn't asked, but it's kind of, do we need to kind of, what do parents look out for? Sometimes children do suffer more kind of with their mental health because they have JAA or long-term health conditions. What is it kind of as a parent that we should look out for before it sort of gets to a crisis point, if say they don't want to have their medication, or they just, it just, because I think lockdown is not helping matters either. Children are suffering out there. So what is the parent, what would we have to pick up on, and where do we go from there really, if say our child is suffering a bit?
So we're very fortunate to have a play specialist on our team who has been instrumental really in helping a lot of children, as Eunice was saying, struggling a little bit with blood tests, and we get her in there, and she's very good with distraction and just talking them through it beforehand, making a bit of a plan how we're going to do it, how they're going to sit on the parent's lap or whatever. And then we also have, if things are more difficult with medication and blood tests, we also have a clinical psychologist on the team. So I think we, if a parent gets in touch to say, we're really struggling here, we would involve the clinical psychologist to help sort of manage and help just find strategies to manage all of that, because as you say, it is a lot and it's ongoing. It's not just for a short while. It's we're in it for the long haul, so we need it to go well.
Yes, I kind of think also sometimes, if they've done really well, they've gone into remission or low disease activity, but then it can come back. Then it's kind of the children might be slightly older and they can feel like, oh, why me? What have I done to deserve this type of thing? So you have those sort of questions as well. And I know obviously over the last 10 years or so, mental health isn't, it's not this, there is a stigma still about it, but we need to talk about it.
Absolutely.
Really, and parents just need to be aware. There are obviously lots of other charities out there, if you kind of feel that you're at that sort of crisis point, and that I think Young Mind is a very good charity as well. But just please do then get in touch with your rheumatology teams as well. They can, they can help you, or they can signpost you to different methods of helping as well. So it's kind of, I think that's really, if you got anything to add on that, Eunice, at all?
I'm just thinking of, there's lots of peer support out there, so that being for other parents, and then a lot of charities also will link up young people, or if you're under a service, they might be able to help with that, so link someone up who's maybe been through a tricky patch but actually come out the other side. So sometimes you can sort of pair young people up, and that can be helpful. So I think it's just having a chat with your team and seeing what's available, but there is lots of support out there. And schools can be helpful as well. They sometimes have counselling services and things that you can also access. So it's just seeing what's about in your area.
Yeah, don't be afraid to ask, really, I'd say.
No, that's it. Yeah. And one of the comments was Lindsay, your walking buddy, came up with that every time her daughter has a blood test or a injection, she gets a pom-pom to put in a jar. And then when the jar's full, they have a treat. Or a present, and I think that's nice too. But I also think it's important for the parents to treat themselves too, because watching the child go through this and to have needles and in a lot of cases have to give them the needle themselves, it can be really, really traumatic. So don't forget about yourselves, and think about how brave you are to do this for your child, because you can see the big picture. And I think a lot of the time parents get so caught up in doing things for their children, they forget about themselves.
I'm guilty of that as well.
Guilty as charged. I know.
yes, do as I say, not as I say. Yes, I must admit, we had our first parent online group last Monday, actually. Gosh, it seems ages ago. And it was so lovely to hear other parents just talking to each other kind of about their stories and how, you know, their advice, not but hints and tips on how to kind of get through it, because we have to, you know, every day is a different day and we do get through it, but some days are different, but we can kind of pass information on to others. So we do have that online group as well, which have monthly meetings. But anyway, stop plugging that now. But I think, Eunice, you did sort of mention schools as well, and I think one of the questions we've been asked is, and let me scroll up, is there's someone saying, I'm currently organising transition for a little boy in my nursery to main school. Do you have any tips for making them, assuming the school, aware of JAA?
So I think it's really about trying to meet them and just having a chat with them, you know, ideally before they start, just trying to get a meeting in. There's quite a few resources available. I mean, NRAS have a good leaflet on helping teachers to understand more about arthritis, and then it's thinking about whether you're happy to maybe share your clinic letters with the school, because it might be helpful for their understanding. And then it really depends on the young person. So some young people, you know, want to keep it to themselves and maybe want to tell a couple of their close friends, and some actually feel quite empowered, and you know, we've had a few young people who maybe want to do a presentation to their class to explain why actually maybe in the mornings I struggle with the stairs, but actually then later in the day I'm taking part in PE, and that sort of indiscrepancy that maybe their peers don't understand, but some of them have actually gone back and wanted to present it, and that's helped them. But it really depends on the child and their personality as to sort of, I guess, in that situation what would work for them. But I think mainly it's about having that conversation, and then I guess if you're having difficulties that you can't resolve, and that maybe some of the charity information isn't helping with, again, going back to your service, because they can help with some of that liaison as well if needed.
Oh, cool. I think also at the moment that would be probably quite useful, because I think the thing is with schools at the moment, we can't go in and have, you know, that normal times we sit down and we'd have a full-on chat with them, and schools aren't parents in. So, but make sure, even if they kind of say, if it's just over a phone, you know, just get that phone call and say, get the conversation started. Really. Elaine, have you got anything to add on that one at all?
Not really, only as Eunice said, you know, go back to the team. We have an occupational therapist who liaises with schools, goes into school if necessary. Yes, as you say, tricky at the moment, but it is possible if it needs to happen. So yeah, there's lots of ways of making it easier for children. For little children, sometimes it's about, you know, not having to sit cross-legged on the floor, because that's tricky, and having a little chair when it's carpet time or whatever, and just, yeah, a little bit of awareness that, as Eunice said, you know, things change day to day, even during the day, and an awareness of that is really crucial.
Yeah, I must
one
admit,
of the sorry,
I was going to say, my schools when I was growing up was they were awful, but then there, you know, to be fair, there wasn't many the information that we've got now, you know, on the internet and kind of books from charities. They weren't really around then, so yeah, please, you know, use all our resources that you can and to get to your schools.
One of my camp kids who was really very, very good at very articulate and could explain a lot, even when she was, you know, 10 and 11, and she worked out with her teachers a traffic light system, and she got 3 different coloured post-it notes, and it was basically red, yellow and green. And when it was red, it was like, no, I'm not doing this, or I can't do this today or at the moment. Green was orange was, I'd like to give it a go, but I'm not promising anything. And green was, yeah, whatever, I'm up for it today, you know, now. And that way they didn't have to bring attention to anything. It was just a simple thing. The teacher saw it there. They all knew what it meant, and they'd negotiated that. So I think, you know, you were saying about taking the letters. I think a lot of the time the teachers just want to know what to do. They don't know. They've not experienced it before. So like you were saying, Elaine, you know, give them the information, tell them what's going on. And hopefully as educators, they also want to learn. So it gives them the opportunity to have those conversations and ask those questions.
No, that's... Sorry, Nadine, looked like you're going to say something.
Yeah. No, it's okay. I was just going to say, you know, so how can parents help their children with self-management? Because we've had one person say here, my daughter is suffering to accept that she's different from others, and she says she doesn't want to be laughed at. What can we, what help we can get? So how can parents help with self-management? What sort of things can you do when your child just doesn't want to be different, which is understandable?
That is a really
Okay.
difficult one.
Yeah. I think one of the things about self-management is there's lots in a child with arthritis in their life that they can't control. So whether that be how their arthritis is going to evolve, maybe what medications they're on, but actually giving them some bits of control really helps them to feel more in control of the situation. And so whether that being giving some of their own medication, whether that be coming to the appointment and maybe starting to talk to the doctor or nurse on their own, so that they feel a bit empowered, and they start to have more of an understanding of their medications and of their disease, and just to help them feel more in control. That can be helpful. And it can be as simple as where the patient sits in the room. So rather than sort of the mum sit there and then the child sit next to it, actually put the child in the key seat sort of next to the professional that they're seeing, so that they can really start those conversations. And maybe them taking some questions or writing them down beforehand, so that if there's particular things they want asked, just to help them feel part of those conversations.
Absolutely.
And we also use something called Ready Steady Go, which is a transition program, really, which is a set of questionnaires, as the name suggests, labelled Ready, Steady and Go. And we start that in the early teenage years, just to kind of start to get them, as Eunice said, to try and take a little bit more interest, a little bit more control, a little bit more understanding of their condition and medicines. And also just in general, it's about lifestyle. It's not something particular to rheumatology. It's available for all young people who are in a healthcare situation. And it's quite nice, because when they fill it in, there's stuff about school and their activities and leisure activities, as well as their condition and their medicines. But it can be quite revealing, and we've certainly had good conversations about a number of topics which are often unrelated to their JIA, but very much about their life. So that's really helpful in confidence and gaining independence.
Yes, and not that I'm biased, but I think nurses are in a really good position to help the children through that journey, because in many ways they're the ones that are a little bit more accessible. The doctors speak a funny language that they don't really understand, but at least with the nurses you can sometimes have a bit of a laugh. And I know that the children I worked with quite closely had very strong bonds with the nurses, that they may not have been able to talk to their rheumatologist as well as they can. And they are, somebody that sort of leads by just being kind to them and treating them like individuals, So, so I'm biased, but I think the nurses do an amazing job in that transition of evidence of how to just see them growing up. And you get really excited when, I've been invited to, one of the kids' black belt gradings, because she's made it as a black belt even though she's had arthritis since she was 4. So it's really lovely to have that journey with them, see them grow.
How does transition work at the Evelina, Eunice? Oh, I think she's frozen. Oh no, she's back. You there?
Oh, sorry, I disappeared.
That's all right. Oh, you still there? I'm not.
We lost her.
I think we have. Yes.
Yes.
Oh,
I'm here.
Oh, you are there. Cool.
Can't
Yeah, the
see you
question
anymore.
was, how does at the Evelina, how does transition work there from sort of paediatric to adult rheumatologists?
Yeah, so we have an adolescent clinic, so for young people 13 through to maybe 18, and then we also have a young adult clinic that's based over in the adult rheumatology department, that's for those that have moved from adolescent clinics through up to about 24, 25. And I know we're quite fortunate because there's lots of services who don't have that. But it does mean that rather stepping from paediatrics into maybe an adult service where you might be alongside lots of much older people, it does give young people that stepping stone into the sort of main adult services. So we're very fortunate, but obviously not everywhere's got that opportunity. But I mean, it is about that self-management and that independence and that, getting young people to a point where they can sort of stand up for themselves and what they want, and kind of go into appointments, quite sort of sure of what they're trying to get out of it. And if they can get that level of independence, then that will help them in the adult services.
Yeah, I must admit, as a parent, my daughter's 14 now. Yeah, trying to sort of give her more control. It's so hard as a parent though, because you kind of feel, well, I can help, and I can see kind of where they're going, with their arthritis, with the JIA, and it's not like I don't trust her at all. I do completely, but it's kind of, as a parent, you're just giving that control over, and it is very hard. And I must admit, but now I'm trying to get my daughter, she now self-administers her medication, which a year ago she wouldn't even touch the medication, let alone get it out of the fridge and self-inject. So it's just trying to, I find little steps does help, and kind of I know obviously different over Zoom now, all our appointments have been over Zoom or telephone, but just trying to make sure that she answers the questions, and I'm kind of more in the background, I'm listening, but she answers for herself now, which it is hard, but as you say, it's part of the growing up that they've kind of got to do. And some people say, the earlier that they can do it, the more empowered the children will feel, to kind of then ask the questions and kind of go through transition and then into adult care a lot easier. When I was a child, and when I then went to uni, I was in an adults clinic. I've been in adults clinic all my life, and it was quite daunting. You're always told, oh, it's an old person's disease, and I was in a clinic when I was 18, surrounded by older people, and it was just like, is this true? I just felt very, very uncomfortable, and for me, I did stop going, which caused damage to me. So please don't do that. Keep going to your appointments, otherwise you can end up damaged like me. So yes, but it is hard, and that, but we can start giving control, and just kind of letting your kids, they're so resilient and they're so adaptable that that will then be part of their normal life, and they will take it on, and you don't have to kind of hold their hand the whole time, and they then might even appreciate it even more, that it's kind of, they feel more grown up.
Yeah, exactly. So somebody was just asking about the Ready Steady Go. Where can they find out more information about that?
It feels like we just have it and have had it for so long.
Well, it's not. We'll look into it as well, and then we can always put some information on our website.
So I think if I'm right, it originally was devised in Birmingham. Is that right, Eunice?
I missed the question. Sorry, I lost my signal again.
Ready Steady Go was originally devised in Birmingham.
I think it was Southampton, wasn't it? Southampton.
Well, yeah, I think, yeah.
Okay, maybe there's some politics there.
I think there was a little, yes. Anyway,
okay.
But yeah, it's been around for a long time, and certainly you can download all the information and the questionnaires. There's also, after Go, there's a Hello to Adults questionnaire, which is very similar to the Go in terms of content. And I should mention, there is also a version for children with special needs, so which is also a simplified version. So it's quite comprehensive. Oh,
Sorry.
Nadine, you were just
oh, there we
muted.
are. Thought I'd lost you all for a minute. I can see Eunice.
We're all here still. But
Okay, so we will find out, put on some links on the website once we've got all of those. So for those that are asking on the questions at the moment, we will put that link on to the JIA at NRAS. That's quite all right. Okay, so is there any other points? We'll finish off in a little bit, but is there anything else that in your vast experience that you parents ask a lot of the time, you know, or things that you would, one piece of advice that you could give to parents of a newly diagnosed child?
I think it's just the first year is probably one of the hardest. There's just so much to get your head around, particularly the first few months. And don't expect to sort of understand it all at once, and that's fine. And that's why we're there as sort of nurses and the rest of the team to support you in that. And you only remember, you know, a small percentage of any appointment. And so we're sort of bombarding you with information. So I think it's just, you know, it's okay. There's no silly questions. There's no, you know, that's absolutely fine to come back with things if you think actually, you know, there's still more I want to understand, or I didn't quite get why. You know, that's absolutely fine. And that's what we expect in that first few months, and particularly the first year.
Yeah, I mean, I always say, I think, you know, we used to say, and I still say it, you know, there's no question too small or too silly, because if you've thought of it, then you need it answered, and it may be very, very simple and straightforward. And sometimes just having the reassurance of somebody who knows, who sees, you know, bread and butter, you know, JIA is our bread and butter. That's what we live and breathe. So for parents, it's new and it's all scary and worrying and alarming. And so, yeah, we're there just to hopefully reassure and hold your hand. And yeah, I think probably the most difficult question is always, you know, how long is it going to be? How long are we going to be on medication? And that's, you know, that's the one that parents want the answer to, which we can never give really. It's very much a wait and see situation, which is hard. And I think that's one of the hardest bits for most parents.
Yeah, and I kind of sometimes, you know, parents do then, it's natural now, you go Google it and you then can just see the worst case scenarios of what happens. But, you know, the medications have advanced so much over the last sort of 20 years. The biologics are kind of a game changer, really. And so, you know, if they are diagnosed quickly and get treated quickly, the chance of long-term damage is very it's very slim. You know, that's not generally going to happen now. It is, you know, but it is kind of the dauntingness of the kind of the hospital appointments, the blood monitoring, etc. But, you know, once they're kind of on the medication, the hospital visits and the blood monitoring, they do decrease. As sort of Eunice says, the first year is the worst. After that, they do decrease. And then it's just then a part of life. It'd be your routine. And it is so easy to think, actually, it is, you know, how was this not a part of my life beforehand, really? And it can be. And having, you know, the support of us and you know, the nurses as well. It's you're not on your own. You're really not on your own. So yeah, so kind of on that note, it's kind of, can you sort of tell us that, you know, you know, families and children with JIA for a while now. So can you tell us a positive story of a child, you don't have to give names at all, that, you know, has really succeeded on their treatment and is kind of thriving in life now? Eunice?
Oh, do you know what? I could think of a couple actually that we've probably both looked after, Elaine. And thinking of, so there's people who we've looked after that have maybe exceeded in their sporting abilities where you maybe might not, you know, you might thought they wouldn't. So we've looked after a young person who got a scholarship to go to America to do professional golf, and she had quite bad wrist involvement. And so, you know, that was brilliant to watch her do that. And we've also looked after a young person who had very significant systemic onset juvenile arthritis and needed lots and lots of treatments and medication. And then to watch her get married and have her own child was wonderful. But I think it's those every day, you know, when you see a young person that you've, you know, maybe known from 2, 3 or 8, 9, and then to see them, you know, grow up and gain their independence and go to university and just do the very normal things in life. It's just wonderful to see.
Yeah. Yes, I agree. And the second person you were talking about is now, having gone to uni, she's now a teacher. And I'm still in touch with her, which is lovely. Eunice and I were fortunate enough to be invited to her wedding, which was a very joyous occasion. And she's doing really well, which is great. But yes, I think many, and I think it's that thing of you know, some obviously I've known since they were little, and you know, 2 first diagnosed and are now, you know, 4 teenagers, and that always seems extraordinary, you know, when I think, oh, how can they be that old, you know? And it's lovely to watch them grow up and just move through life and with very little impact from their arthritis, really. I think just getting on, doing their rugby, doing their cycling, you know, just being normal teenagers and enjoying life, as Eunice said, going off to uni and just, yeah, having fun. So it's good to see.
Yeah, we've got the Young Voices panel, it's an advisory board for us, and they've been going a year now, and it was kind of an eye-opener, I think, for people in NRAS, that actually young people can thrive with it. I think they sort of said, you know, one advantage of having it as a child, they don't know any different. It's now part of their daily life. You know, some days they take the bad days, that's kind of a given, but they generally, you know, really appreciate the good days and actually push themselves a lot more, because they know even if the next day they're going to be a bit sore, they just push themselves, and they are doing so well. And children can do, I should say, they can do professional sports, they can do anything that they want to do. Really, it's just kind of, I think it's a case of looking after yourself, learning more, kind of being more empowered, more awareness of what's going on, and just living life as you should, really. JAA should not stop you at all. I've climbed Mount Snowdon, my daughter has, not that we're professional athletes at all, but you know, you can just do the normal things that normal kids do, and just take the bad days as a bad day. Don't get too stressed over it, and just, you know, just appreciate the better days, and they will come.
We've had someone, Anna Marie, saying that she couldn't walk because she had polyoarthritis and it affected 12 joints. Now she plays for a girls' football team, and I still get emotional watching her play. And I can understand that, you know. Like I said, you know, I ran camps for these kids. I'd only see them for 1 week a year, but I got to see them over 8 years, and then once I left there, they continued to keep contact with me. So, you know, one couple that drove me insane because I kept having to separate them, and they swear blind nothing ever happened there, but they now have 2 children. And so, you know, I see them as, you know, surrogate, you know, grandkids, because I saw them grow up and thrive and live their best life, like you said. And yeah, so it is really positive just to see them, as Elaine said, living their every day, which is just beautiful. And as Deb said, when the Young Voices panel first started, we were talking about, you know, how we could, their theme, which was, you know, living despite having arthritis, and they said, no, not having any of that. We are thriving despite having JAA. And so it's not just living, it is stepping out there and being the best that they can be. So did we have any other questions before we finish off?
I don't think so. It's been a while now. So I just want to say thank you both so much for giving up your time this evening. As I say, it's the first Wear Purple for JAA Wellbeing Week. We do have more Facebook Live sessions to come each night. We've got Adults with JAA tomorrow, again talking how we're doing well in life with our JA not stopping us doing what we want. We've got the parents having a chat on Wednesday evening, and on Thursday we've got children asking healthcare professional questions, trying to empower them. As we say, it's so important to empower the children. So I'm stepping back and the children are going to take over and asking healthcare professional questions. Not all about JA, I must admit. It's just kind of, if you have a good rapport, especially, you know, with the nurses that we have here, you know, you've obviously had a great rapport with your patients, you know, it can happen. And it is just kind of, I'm fine is never an answer, because you're generally not fine. So it's just kind of getting that conversation going. And we have more wellbeing classes as well. So if you want to look on our website, it's jaa.org.uk. If you click under Wear Purple, you can see we've got more classes this week, and again, more Facebook Lives. So a really heartfelt thank you so much. You've been doing an amazing job, especially over the last year. So from, I suppose, all your families, so thank you so much for all the work that you do.
Yes, thank
Thank
you.
you.
Cool.
Thank you for having us.
That's
Okay.
our pleasure. So yes, night everyone.
Good night.
Night.
Thanks.